Welcome back. To a health concern we have been monitoring recently, the health department confirmed that cholera was spreading within communities in this country. Up to that point, cases were linked to people who had travelled to neighbouring countries where cholera has broken out. Malawi, for example. There is a warning in place for baptisms not to take place in our rivers. But given our water infrastructure challenges, rivers are also used for bathing and washing clothes. Let's discuss the risks now with Dr Phuti Sekwadi, an epidemiologist from the National Institute of Communicable Diseases. Doctor, thank you so much for your time this evening. Can you give us an update on exactly how many cholera cases we're looking at the moment?
Good evening to you and also to the viewers. At the moment, we are sitting at 11 confirmed cases of cholera, and these were confirmed between February and March. And all these cases were identified in Gauteng, 8 of them in the city of Johannesburg, and 3 were from the city of Ekurhuleni.
What areas are most vulnerable to community outbreak given sanitation challenges that we experience?
Well, with cholera, the communities that are at a higher risk to experience large outbreaks, those communities where they are still making use of water from open source, surface water sources such as rivers and lakes. So people who still make use of those sources for drinking water and for bathing, for all the other activities that that anyone needs to do. So those are the people who are really at risk, the people who are still making use of water from those sources.
Is there any risk for people perhaps living in an informal settlement who are using communal taps? Would that be a concern or not as yet?
Well, communal taps, generally the risk is very low of having cholera transmission or people getting cholera through consumption of water from communal taps, because that's usually treated water. It's only the untreated water from rivers and other sources like that that pose a greater threat, for many other infections, even outside of cholera. There are many other infections that people might contract when they are consuming water from those sources, because we know, with the challenges in terms of infrastructure, sanitation infrastructure, the issues of broken sewage and leaking sewage, most of this sewage flows, they end up in these rivers that we are talking about. So that really just increases the risk of people who make use of water from those rivers, the risk of contracting all kinds of illnesses.
So given that we're looking at the city of Johannesburg and the city of Ekurhuleni very closely, where specifically are you monitoring to see or to try and prevent or pick up early on possible new cases?
Well, we have systems in place. We have the notifiable medical condition system, which is used by all the healthcare workers from both the public and the private sector across the country. So there are case definitions that we have shared with all the healthcare facilities across the country, that healthcare workers should be on the lookout for, specific symptoms that are typical of cholera. And cholera, it's notified upon clinical suspicion, so they don't even have to wait for a lab confirmation to alert the Department of Health and also the NICD of a suspected case. And then that will initiate a rapid response in terms of making sure that cholera is excluded through a laboratory test as quick as possible, and to get a quick diagnosis as well if the patient is indeed cholera positive.
Can you tell us some of the signs or symptoms that people should be looking out for, and if they suspect they might have cholera or they feel unwell, that would prompt them to go and see their local clinic or GP?
Well, the most telling symptom is severe dehydration, especially among adults. Severe dehydration and also acute onset of watery diarrhea. So with cholera, people often get very watery diarrhea. Sometimes it may have the appearance of rice water appearance. That usually we see that most of the time in severe cases of cholera. But the main two symptoms really is dehydration and acute onset of watery diarrhea, like very watery diarrhea. And it can happen, the diarrhea usually occurs very frequently. So within hours, a person could have many episodes of diarrhea. So when you see those symptoms, the best thing to do is to go to your nearest healthcare facility and then also give them a background. I think giving the background or the history is very important. If you know you have been, you have been exposed to water sources such as rivers, or if you have drank water from those sources, it's important to give that information to the healthcare workers so that they can suspect cholera, so that they can have that background. And if you have traveled as well to some of our neighboring countries where there's ongoing outbreaks of cholera, and upon return you experience these symptoms, you should go to your nearest healthcare facility as quick as possible, and also give that history as well to the healthcare worker that you will be presenting to. Otherwise, in cases of mild or if you are not too sick to warrant going to a hospital or a clinic, cholera is completely manageable, is treatable, and treatment it's easy and it's not an expensive treatment. So people should know how to prepare the oral rehydration solution, which is the main treatment for cholera, and it's basically a mixture of salt and sugar and water. A simple formula is that 6 teaspoons of sugar and half a teaspoon of salt in a liter of boiled water.
Thank you so much, Dr. Phuti Sekwadi. Unfortunately, we are going to have to wrap it there. We really do appreciate that. Electrolyte solution, the best treatment if you cannot get to your clinic urgently, but do make a plan to get to a medical practitioner if you do show any of those symptoms. That was Dr. Phuti Sekwadi, an epidemiologist from our National Institute of Communicable Diseases.